Time now to ask the expert, and here to answer your questions once again live is Dr. Sonal Haerter. Okay, so let's get straight to it. Tim from Peoria says, are there generic versions of Ozempic to help keep costs down? Because it is so expensive.
It is expensive, and here's one thing I want to clarify. Ozempic actually was FDA approved for diabetes in 2017, and Wegovy, which is basically the same ingredient as Ozempic, was actually FDA approved for obesity in 2021. So we often think of Ozempic as a weight loss medication, but it was actually approved for diabetes type 2.
Yes.
Now, does it help with weight loss? It sure does, but it was not approved for weight loss.
Okay,
so,
good
but
clarification.
Semaglutide is the generic for Ozempic or Wegovy or Saxenda, and basically they all are called GLP-1 agonist medications. And these are medications that actually you can get patient coupons under certain websites, but these medications unfortunately are expensive.
Yeah, and so there are not generic versions.
So there's generic version, but I don't think there are any less expensive than Ozempic or Wegovy. Yes.
Oh, so much for generic then. My gosh. Okay, so Emma from Chandler says, how do I know if Ozempic is right for me?
Oh, Emma, that is such a great question. And this is all about safety. So this is when you have to actually get this medication from an expert. So obesity specialists, endocrinologists, family medicine, internal medicine, doctors or nurses or APPs who are actually well versed with how to use it, asking questions about your personal risk factors. For example, somebody who has history of medullary thyroid cancer is not a good candidate for these medications. It's actually a big risk. Someone who has pancreatitis or small bowel obstruction or stomach obstruction.
Yeah.
So it is very important to sit down with an expert and discuss your risks and benefits before you get on these medications. Do not get these medications off of internet. That is not the right way to use them.
Yeah, no, okay. And as we said before in our last segment, it's not for, a quick fix, like 5 to 10 pounds.
Correct.
Okay. Shelley from Avondale says, what are pros and cons of Ozempic?
Correct. So pros, let me talk about those. These are the group of medications that actually help you slow down your digestion. People consume less calories, but also shut the food noise. So we haven't had that many medications that go in your brain and change the signaling of the brain. So the appetite and the hunger center, it kind of balances that, and people eat less because of less cravings. Right. In fact, we have preliminary results on alcohol use, and people are reporting less alcohol cravings also on this medication.
Wow.
It also helps with anti-inflammation, and we know that this is actually helpful for heart disease and heart failure, reduces the incidence of stroke and heart attacks, along with stabilizing your blood sugars, producing more insulin. So of course, great pros. Yeah. Now cons, you can get pancreatitis. There is obviously nausea, vomiting, constipation, diarrhea, which are very common. In very extreme cases, you can get lazy intestine or colon, which is, where it slows down so much that it becomes a risk factor for the patient. So there are some serious cons, although the absolute risk is low, but again, not for everybody. Exactly.
Yeah, exactly. And so once you start feeling something wrong, definitely notify your doctor.
Absolutely.
Right?
And that's why these patients need to be monitored closely,
No
right? Because you have to follow every symptom and every signal that the body is giving them about these medications. Yes. Okay.
Ooh, good stuff. Andrea from Mesa says, I've tried drugs and diets before, but the weight always comes back. What should I do?
And Andrea, this is something I see in my practice as well. That's why obesity is a chronic disease. We know this from so much research now. There's a genetic component, environmental component. There's also behavioral disorders along with lifestyle modifications. So Andrea, you might need this medication, one of these medications, for a long term, just like how we use medications for high blood pressure and cholesterol. Sometimes for some people, this is not a small treatment, but this is long-term treatment.
Wow, okay. Tavia from Avondale, if people are not diabetic, should they use Ozempic? Can it be safely and effectively used for weight loss without the side effects? Great question.
Great question, Tavia. Now, Ozempic, again, is for diabetes, so we do not use this particular name for obesity or obesity-related complications. So for people who do not have diabetes, if they qualify for medical diagnoses of obesity, which is a very specific criteria, or obesity-related complications, then they do qualify for these medications. I would not say Ozempic, but I would say Wegovy.
And so when they qualify, it's also covered under insurance.
Correct, and they are still expensive under insurance. So I just want people to know, I'm an obesity specialist and I have a hard time getting some of these medications approved or authorized. So it is a real challenge to get these medications approved.
I bet. Okay. Excellent, excellent advice, Sonal. Thank you so very much. We appreciate your time.